We don't serve patients well unless they encounter engaged, prepared healthcare teams. Teams who have an emotional and psychological commitment to their work and show up every day and give their all and care and try. My goal, quite simply, is that I help you show up differently. I want you to be able to go back to your office, back to your team, back to your site, and be able to say and do new things so that you get better results. There are a handful of conditions that, when present, lead people to care and try and give their all. And those conditions are largely created, installed, and maintained by you, by their boss, by their manager, and by the physicians that they work with. And so let's talk about what you can do every day to create the conditions that lead people to thrive. That is why, again, you are the most important people in healthcare, because it's up to you to create those conditions. This is a key point for everything that comes after today. Behavior is observable, it is documentable. Behavior is action.
He's very real. He's easy to follow. When he gives you examples of things you would actually say, the behaviors that he discusses are real. We see them every day.
By a show of hands, how many of you have someone on your team who is just such a hot mess, we should probably stop blaming them and start blaming their mama? Guess what? That person needs to feel included too. The phone nurses, this might be what you say. Once you have this whole dialogue, she may not want to pitch in, she might not think she has to pitch in, but you've made it clear that she does. Will you commit to that before you leave my office? Yes or no question. If the answer is yes, you've got the accountability in place. If the answer is no, you're now down a path to a whole other conversation. The shortest path to patient satisfaction and a team that is firing on all cylinders is a leader on site who knows how to get the most out of their team. If we come to those conversations and we think of them as discipline, what we're bringing to that conversation is you bad, I'm right. Instead of bringing, I care enough about you to help you identify ways to be more successful.
What I've noticed about Joe is he's just the real deal, if I can say that. He is somebody who comes, he listens to what your issue is, and he breaks it down very simply, and you can apply it not only to your practice, but your life.
So I don't care if your title is Supreme High Commander of something really important. You should still go out to the floor and room patients and answer the phones and clean out the skanky, smelly lounge refrigerator every once in a while. That's how you develop trust. That's how you earn respect. And trust and respect are the magic dust of leadership.
I thought it was great. I thought it's very, very topical, very relevant.
He gets it. He gets healthcare, and that's a big thing.
Extremely motivating, captivating. He's personal, he's direct, and he's hilarious, and he's super good at what he does.
And it won't happen overnight. But if you show up every day and pour those things into your team, you will absolutely end up with a healthcare team who works hard, gets along, and wows patients.